Hello, everyone. Today we are going to discuss integrated management of childhood illnesses, also called IMCI. This is the part one of the session. I'm Dr. Abida Munir Badini, Assistant Professor and Consultant Family Physician at the Jinnah Sindh Medical University, Karachi, Pakistan. The objectives of today's session are that we are going to discuss how to diagnose and manage some common childhood illnesses, such as pneumonia, malaria, and measles, and how to prevent these conditions based on the IMCI recommendations. So let's discuss what actually IMCI is. For this, imagine that you are in your rural clinic. A mother brings a 3-year-old boy to your clinic with complaint of high-grade fever and lethargy. Lab facility is not available in your clinic. What will be your next move? This is where IMCI comes into play. The IMCI was developed by the World Health Organization, WHO, and UNICEF to improve healthcare services and reduce childhood deaths. The common conditions addressed include pneumonia, diarrhea, malnutrition, malaria, and measles. The goal of the IMCI to reduce mortality in children who are under 5-year-old, to improve their growth and quality of care in children who are ill. So there are different steps when you're managing a child according to IMCI guidelines. There are different steps that are followed. First of all, you have to assess the child for any danger sign. This is the first step and the most important step. And then you are going to see all the presenting health problems. After that, you're going to classify the child's illness using the color codes that have been provided. Then you will identify which treatment is needed for that particular child. You'll provide that treatment. Then you're going to counsel the caretaker. And then you're going to provide the follow-up care. So what are danger signs? Any child who comes to you with these signs, this is a child who is at high risk of mortality, and this is the child who will need urgent referral. So the danger signs are when the child is not feeding, the child is not taking the mother's milk, or the child is vomiting everything that they are taking, or the child is having fits or convulsions, or the child is lethargic or drowsy. All of these are danger signs. So if any danger sign is present, this will be in the pink code, which means that's a very severe disease. If the child is having fits, you're going to give them diazepam. The dose is 0.2 to 0.3 mg per kg. You can't give more than 10 mg. So then you're going to quickly complete your assessment, give any pre-referral treatment, try to prevent low blood sugars by giving 10% glucose. The dose is 5 ml per kg body weight by NG or IV. Keep the child warm and then refer urgently. So here is a case. You're in your rural clinic. A 2-year-old child comes with fever, cough, and fast breathing according to the mother. Obviously, no labs are available where you are practicing and there's no x-ray. What will you do? So what you're going to do is that first you're going to ask that for how long is the child having these symptoms, which is very natural in our history. We ask for the duration of this, about the duration of the symptoms. Then you're going to start your examination. Look, listen, and feel. You are going to look at breaths per minute. You're going to count the breaths per minute. When you are counting the breaths, just be careful that the child should be calm and relaxed. If the child is crying or uncomfortable, try the mother to give the child feed or calm down the child, and then you restart your breath count. If the normal breaths count, you should all know it. And but if a child is 2 months to 1 year old and the breath rate is per minute is more than 50, that's called fast breathing. For a child who's 1 year to 5-year old, breath rate of 40 per minute or more is called fast breathing. Then you're going to look for chest indrawing. Again, the child must be calm so that you could appreciate it better. Then you are going to listen, look and listen for, you're going to move a bit closer to the child. You're going to listen to stridor. Stridor is a sound that comes with inspiration. Then you are going to look and listen for wheezes. If there are wheezes in the chest or the chest that you see chest in drawing, you can give a trial of inhaled bronchodilators. You can give them salbutamol, about 2 puff every 15 minutes. Just give them 3 times. If the child gets better, that's fine. And then you're going to reclassify the child again. This is chest in drawing. I've provided a link, or maybe you can find it yourself in YouTube. Find how chest in drawing looks. It's just below the costal margin. Chest in drawing means that the child has respiratory distress. For the chest in drawing to be present, it must be clearly visible, present at all times. And next is Strider. For Strider as well, you have to try to listen to Strider through any YouTube video and familiarize yourself with how Strider actually sounds. So now that you have done your initial assessment, let's classify the child's illness. You're going to see if there is any danger sign or Strider in a calm child. If you find any of these danger signs or stridor, this means that this is severe pneumonia or very severe disease. So for this child, you're going to give them the first dose of antibiotic and urgently refer to a nearby hospital. Now, the next is if there is chest in drawing or fast breathing, but there's no stridor and no danger sign. Just there is chest in drawing and fast breathing according to the age of the child that we discussed in the previous slide. You are going to label this child as having pneumonia. Okay, so when you label the child as having pneumonia, you have to give them amoxicillin for 5 days because this child does not have any danger signs, so you can easily send the child home. Give them amoxicillin for 5 days. If there is wheezing, you give the child the bronchodilator, as I mentioned earlier, and you can even give them bronchodilators for home for 5 days. And then if the child has HIV or if has been infected with HIV, you have to refer this child. Then give some safe remedy to soothe the throat. Remember, honey is something that you can give to a child who's more than 1 year old. Below 1 year old, don't give honey because there is a chance of botulism. You have to avoid that. And then if the child is having, just remember if the child is having cough for more than 14 days or there is recurrent wheeze, so you have to reassess this child because this child could have TB or asthma. You have to assess them for these conditions. Always when you are sending a child home, you have to counsel the mother. You have to tell them about the danger signs. If the mother feels any of the danger signs are present, you have to counsel the mother nicely. She has to immediately return. And then with a child who has pneumonia, you have started them on antibiotics, call them back in 3 days after explaining the red flags to the mother. But in case, then there's this green box, right? So if the child does not have chest in drawing or fast breathing, he just has cough. So you can say that maybe there's no signs of pneumonia or very severe disease. You will classify as the child as having cough or cold. Again, you have given bronchodilators to a child who has wheezing, and if the child gets better, you will send the child on bronchodilators for 5 days. And then you can advise the mother when to return. So for soothing the throat, a little baby, even if they are having continuous cough, even mother's milk is soothing. For child more than 1 year old, maybe you can give the child honey or some sugar syrup. Pneumonia is actually acute respiratory infection of the lungs. And when the child develops pneumonia, their lungs become very stiff. And one of the body's response to stiff lungs or pneumonia is hypoxia. The child, because there is too little oxygen, so to compensate that, there is fast breathing. Okay, so the main causes of pneumonia are strep and Haemophilus influenzae. Respiratory syncytial virus is also one of the cause. 22% of total mortality in children is because of pneumonia. So it's very important that you should know how to manage pneumonia. Remember, we said that when the child is diagnosed as having pneumonia, when you classify the child as having pneumonia, you have to give the child amoxicillin, which is a drug of choice. Here I have shown a table where the dosage, how much amoxicillin you're supposed to give to a child is given for a child 2 months to 12 months, 12 months to 3 years, and 3 years to 5 years. And based on body weight as well, how much amoxicillin you can give is written over here. So a child 2 months to 1 year is 5 ml. We are talking about 250 mg per 5 ml. And then for 12 months to 3 years, it's 10 ml, and 3 years to 5 years, it's 15 ml. Okay. So we are giving this medicines, amoxil, 2 times a day for 5 days. How can you prevent pneumonia? Remember, prevention is better than cure. So how can you prevent pneumonia is by giving the child vaccination. As you know, vaccination is given to all children according to your country guidelines. The 2 vaccines that are given to children, one is pneumococcal vaccine, the other is Hib vaccine, which is Haemophilus influenzae vaccine. They prevent pneumonia in children. Apart from that, breastfeeding, this is again protective, and avoid, you have to control the environmental factors like the smoking. The child should not be exposed to cigarette smoke, and indoor pollutants should be try to be avoided so that the child can live a healthy life and pneumonia can be prevented. Next, we are going to discuss malaria. Okay, malaria, as you know, is a parasitic infection caused by Plasmodium species, and it is transmitted by Anopheles mosquitoes. So what IMCI is focusing on is early detection, treatment, prevention, and prevention of complication and reduction of mortality in children. So this is the most serious thing about malaria is that 608,000 deaths have occurred in 2022 due to malaria, and sadly 76% of them were children under 5 years of age. The symptoms of malaria are headache, vomiting, there could be dry cough, there's nausea, and there's high-grade fever. How are we going to diagnose malaria? So there are 2 types of tests, blood smear and rapid diagnostic test. Blood smear test is the gold standard test in which they take a thick smear and a thin smear is taken. And with thick smears, you can actually, the idea behind these 2 smears is that with thick smears, you can better detect parasites, and with thin smears, the species is identified. So this is the gold standard test, but you have to be very careful. One test is not enough to diagnose somebody as not having malaria. So you need at least 3 tests, 3 blood smears taken 12 to 24 hours apart to diagnose somebody as having. If the 3 of the samples come negative, then you can clearly say that the patient does not have malaria. With 1 smear test, you can't say for sure. The other test is the rapid diagnostic test that we have discussed. It's also called ICT. Let's discuss a case. A 3-year-old boy presents to your clinic with 2-day history of high-grade fever, chills, vomiting, and lethargy. How will you manage this child? Now let's look again at what IMCI says. So according to IMCI, does the child has fever? If yes, you have you have to decide whether there is the risk of malaria is high or low, right? So in some countries, there is a high risk of malaria. In some countries, there is low risk of malaria. Then there are different seasons. There's a season where there's high risk of malaria, and in some countries, in same cities, in certain seasons, the malaria tends to decrease. But there are high risk countries and low risk countries. Look at your countries, find the stats of your country. Then you are going to ask for how long has the child has been having fever. If the fever has been more than 7 days, for 7 days, is the fever has the fever been there every day? And you're going to ask about measles as well, if the child has had measles in the last 3 months. Remember, we said ask, then look and feel. So you're going to look and feel for stiff neck, right? Stiffness neck could also be found in meningitis. You're going to look for runny nose. Runny nose means the child might be having viral infection. You're going to look for any bacterial cause of fever. It could be in the throat, it could be in the ears, and look for signs of measles if the child is currently having any rash, cough, runny nose, or red eyes. So a malaria test, if there is high risk area, there's high risk of malaria. In all cases where where there is a child presents with fever, you are going to test the child. If you don't find any specific cause for fever, you are going to test them for malaria. In low risk countries, if you don't find the child is having fever, but there is no obvious cause of it, so even then you're going to test the child for malaria. So then you're going to classify the fever as high or low malaria risk. If there is any danger sign, remember we discussed the danger sign previously. So you're going to look for any danger sign or stiff neck. If they are present, this is severe illness. You're going to refer this child, but before referral, give them a dose of artesunate or quinine, right? These are the drugs that are used for severe malaria. So if you have this in your clinic, you're going to give them the first dose, and then you're going to give them first dose of an appropriate antibiotic. Again, try to prevent low blood sugar. If the child is having high-grade fever, give them paracetamol and refer the child to the hospital. So if the child does not, in case 2, if the child does not have severe disease or any red flags, if the child does not have any danger signs or stiff neck, and the child has been tested and malaria comes out positive, then obviously the child has malaria and you are going to give them the first line or oral anti-malarial. That we are going to discuss what is the first line oral anti-malarial. Again, if the child has fever, you treat the fever, give an appropriate antibiotic if you find any bacterial infection with it. And then you're going to, in every case that you send the child back home, you're going to counsel the mother about the danger signs. Again, I'm going to say that if the mother feels that the danger signs that you have explained to them, any one of them appears, she has to quickly rush the child to the hospital. Follow up this child in 3 days, and when the child follows up, check the child, how the child is doing. If the fever persists for more than 7 days, refer this child to a pediatrician or to a hospital. Now, in case the child had fever, but the malaria test comes out negative, right? But this child still has fever. So you're going to classify this into the green zone, which means that there is no malaria. You're going to give the child paracetamol. If you think there is any bacterial infection, maybe the child is complaining of a pain in passing urine, or we have discussed ear, on throat, or anywhere you suspect that there is bacterial infection, give them appropriate antibiotic. Again, explain to the mother the danger signs. Follow up in 3 days. So over here, when we discuss that if there is a danger sign and there's stiff neck and you suspect that this is very febrile illness, severe febrile illness, give first dose of artesunate or quinine. So quinine is readily available most of the time. The first loading dose is 20 mg per kg, administered over 4 hours. So you're going to pass IV cannula, you're going to start quinine, and then refer the child. You can give for glucose, we have already discussed. And so what is the first line? What is the first line drug for management of malaria? You can give either artemether or lumefantrine, which is the drug of choice. You can also give them artesunate plus amodiaquine. So here the table actually shows how many tablets can you give to a child. For a child weighing 5 to less than 10 kg, you're going to give one tablet 2 times a day for 3 days. So one tablet BID, one tablet BID on day 3, one tablet BID. Under 14 kg, one tablet BID for 3 days. 14 to less than 19 kg, two tablet BID for 3 days. And similarly over here you can see the dose of artesunate plus amodiaquine. This is the one where with 25 mg artesunate and 67.5 of amodiaquine, and this one has 50 mg of artesunate and 135 mg of amodiaquine. So again, the dose is written over here. This is usually the 25 mg is given to small children weighing less than 10 kg, 5 to 10 kg, while 50 mg of artesunate is given to children who weigh more than 10 kg. So again, prevention is very important in case of malaria. We all know that to prevent malaria, you have to try to keep your body covered by wearing long sleeves clothing and clothes which cover the body properly. And you're going to advise everyone that when they're sleeping, use mosquito nets to prevent the bites, use mosquito repellents. And there is also malaria vaccine, which has been started by WHO. WHO recommends the use of both RTSS and R21 or Matrix M. These are the vaccines for malaria, for prevention of malaria in children living in malaria endemic areas. So if they are available in your area, you can always give the vaccine for prevention. We're going to discuss measles now. So measles is a very contagious viral infection that primarily affects children. The cause is measles virus, and the maternal antibodies tend to protect the child up to 6 months. And what are the symptoms? Measles presents with rhinorrhea, stuffy nose, runny nose, fever. Then there are Koplik spots. These are white spots on red base in the oral mucosa. These are just seen just before the onset of rash and symptoms. The other symptoms, these are the first symptoms that appear and the first to go as well. And then there is the actual rash. The rash starts from the back of the ear, spreads from the upper body downwards. The child is infectious 4 days before and 4 days after the rash. So if a child is going to school, you have to keep the child at home even after the 4 days after the rash. Measles has various complications. It's not a very innocent disease. A child could have pneumonia. It could lead a child to having severe diarrhea, encephalitis. It can lead to blindness. It can lead to ear infections. Blindness could be because of corneal inflammation and scarring ulcers because of measles. So here is a case. A child, Ajit, who's 18 months old, comes with fever, runny nose, and a widespread rash. The mother says that the rash started from the face. So what you're going to do is that you're going to ask the complete history. Again, look for and ask for danger signs. You're going to ask if the child has measles. If the child has measles now or within the 3 months, you're going to look for mouth ulcers. You are going to look for clouding of the cornea, right? If you look at this, this is normal, but over here, this looks like milky. So this is clouding of cornea. You look for this, even if the child had had measles 3 months, within the last 3 months, you are going to look for these signs. So you're going to see clouding of the cornea. You're going to see if the child has pus draining from the eyes. So how are you going to manage a case of measles? Again, you have to classify on pink, yellow, or green. So pink or red is if there are danger signs present, or if there is clouding of cornea that we saw just a while back, or there are deep, extensive mouth ulcers. Because of these ulcers, the child would not be able to eat. So if any of danger signs are present that we had discussed previously, journal danger signs, clouding of cornea, or extensive mouth ulcers, so you are going to label this as severe complicated measles. Give the child vitamin A. Give the child first dose of an appropriate antibiotic. And if you see that there's pus draining from the eye, apply tetracycline eye ointment and then urgently refer the child to hospital. Okay. So in second case, the yellow part of the table, if the pus is draining from the eye or there are mouth ulcers. We are not talking about clouding of cornea. Remember, that can lead to blindness. We are just talking about pus draining from the eye. Or if you see that there are mouth ulcers, but they are not very extensive. So danger signs are not present. You are going to label this as measles with eye or mouth complication. Again, with every measles case, you're going to give the child vitamin A. And for pus, again, you have to give tetracycline eye ointment. If there is mouth ulcers, give the child gentian volant to be applied in the mouth and follow up the child in 3 days. With follow-up, again, I'm going to mention mother, explain it to the mother, the red flags, explain the red flags to the mother, that when is she supposed to come urgently to the hospital if anything like that happens. Okay, so if the child has had, then there's the green part where you don't see any pus draining, any mouth ulcers, no danger signs, no clouding of cornea. So either the child has measles now, or the child has had within the 3 months, or the child is even having measles now, but these things are not present. So this is just measles. Give the child vitamin A and send the child home when explaining to the mother when she can return. Vitamin A is very important because it prevents eye complications and blindness. And now, what is the dose? This is the dose of vitamin A. You're going to give 2 doses. When the child comes to you, immediately on diagnosis, and 1 dose the next day. So less than 6 months, 50,000 international units, day 1, day 2. A child who's 6 to 12 months, there is 100,000 units on day 1 and day 2. And if the child is more than 12-month old, then 200,000 international units on day 1 and the next day. How can you prevent measles? Measles is prevented by, that measles vaccines. And then you have to isolate a child who's having measles for about 4 to 5 days after the appearance of rash so that it's not spread. And when you yourself are examining the child who you think is having measles, wear a proper mask and then sanitize your hands. So that is it for today. The key message from today's session is that early diagnosis is very important. By early diagnosing and managing, you can actually prevent a lot of mortality in children. And timely referral is again very important. You should know what are the danger signs and when you can refer the child. This will prevent complications. And thirdly, the most important thing, prevention is better than cure. Whenever there is vaccination available, do offer it to the child. and hygiene and breastfeeding is extremely important in preventing these diseases. So that is it for today. Thank you, everyone. There is just one more thing. I have added a few dosages of medicines that we have mentioned so far. I've written the dosages of diazepam, ceftriaxone in case you suspect there is bacterial infection and you want to give the first dose and want to send the refer the child. So how much can you give? What are the dosages? It's present in this chart. And that's it for today. Thank you, everyone.